Dental practitioners play a key role in shaping a child's earliest experiences of the dental visit. By creating a positive, non-threatening environment, children will develop confidence and a high degree of comfort, helping to ensure positive experiences across their lifetime of dental care. In this program, you will learn about the psychological factors influencing a child's behaviour, learn some of the skills and qualities necessary to successfully treat a preschool-aged child, and take a look at a selection of case studies to identify the structure of a successful dental consultation. Child behaviour changes in relation to age and psychological development. Children younger than 2 years old have little ability to interpret verbal contact, making effective communication difficult. Rapport with an infant can be developed through non-verbal communication approaches. An oral examination and some treatment can be accomplished without sedation. 2-year-old children have limited vocabulary. They have a strong need to touch and observe objects, but are usually shy of new people and places. 3-year-old children tend to have a better vocabulary and are generally easier to communicate with. They also tend to feel more secure in the presence of their parents or carers. 4- and 5-year-olds usually listen with interest and respond well to verbal directions. They have lively minds and can be great talkers. Generally, they are cooperative patients who have little fear of leaving their parents and can establish good communication with adults. While these descriptions provide a good general overview, it is important to recognise that each child should be assessed as an individual.
My style does depend on the age of the child that I'm treating. With very little children, we're talking about 1 year to 2 years old, they're not going to interact with you that much. So I talk to both mum and child, and depending on the child, some children are more interactional than others. But when we're getting into the slightly older age group, like the 3-year-old, 4-year-olds, I do talk to them in preference a lot more and ask them questions and really engage in conversation with them. So I would say that's the main style difference between the two groups.
Being an effective communicator is one of the key attributes of a successful oral health practitioner. It is essential to pitch your advice and instructions appropriately to the different age groups you treat. Some of the most important features people look for in an oral health practitioner include a gentle, friendly manner, someone who clearly explains treatment procedures, a practitioner who keeps pain to a minimum by showing care, empathy, support and reassurance, sound technical skills, and a practitioner who is honest and open.
So Lorian, this is what I'm going to do. I've got to put these glasses on, okay, just like that. And then, have you ever played peekaboo? You know how you play peekaboo? See, you play peekaboo? And I'm still the same. You can see I've just got to put this mask on. And the mask is to stop me breathing over you. So I'm just going to put some gloves on like this, okay? And you've got your bib on. That's really good.
I usually go out and try to find what their specific interests are. Some kids walk in with a Superman jacket or something, and I totally ignore the dental side of it. I don't say, oh, you're here to see a dentist today.
When communicating with young children, I think one thing that's really important is to keep a cheerful countenance, so to smile a lot and engage them, just be bright and cheerful. Sometimes a tone of voice helps a lot rather than a monotonous tone to sort of go up and down, and if you hear children's storybooks, they sort of vary their tone a lot. That catches the kids' attention, I find. Often I try to greet them initially without a mask so they can see that I'm a normal human person. And depends on the kids. Some kids are a bit more outgoing, so you can establish this, oh, look at your Spider-Man shoes, are you Spider-Man? And well, you're on a home run if they respond. And some kids just take a little longer to pick up. maybe you might want to engage a sibling first and say something really simple like, is this your sister? And that's a simple yes or no. They're not put on pressure, put in a bit of a spot to give you a long answer, and then you can build on that.